Increasing your PTSD rating to 100%. There are three steps that are readily available for veterans who wish to increase their PTSD if it's severe enough to warrant a higher rating than what they've been awarded. Step one, you can appeal the decision or file a new claim. Appeal the VA decision. On your original claim, you have up to a year to appeal. After that, you can just file a new claim. When you file a new claim or appeal, it's recommended that you present more evidence to bolster this claim. And it's important that this evidence is vocationally related. Focus on your mental health symptoms and how they limit your ability to live and work. Two, you can prove individual unemployability or TDIU. A vocational expert is often the service you need to do this. Total disability based on individual unemployability, TDIU, is one way a veteran can get to 100%, even though their service connected disabilities individually or together isn't 100%. TDIU isn't just limited to PTSD cases. This is a benefit that's available to veterans who can prove their service connected disability if it makes them unemployable. TDIU ensures that a veteran can receive monthly compensation equaling that of 100% rating, even though their service connected disabilities do not add up to that. To be eligible for TDIU, a veteran must have either one disability rating of 60 or higher, or a combined disability rating of 70 with at least one service connected disability at 40% or higher. When you apply, you need to explore specific vocational limitations that are experienced with your PTSD. Things like difficulty concentrating and focus, and a vocational expert can help quantify this for you. Anxiety attacks. These things affect pace, persistence, and concentration, and these are vocational terms that a vocational counselor can put into your report that your doctors and other mental health professionals cannot do. You have increased fatigue and energy depletion. These mean lost days at work, difficulty managing stress, social anxiety, and difficulty interacting with colleagues. So, this may eliminate jobs where you're having to interact with others. Let's look at some more work limitations. So, a VA disability rating is based on functional limitations of each service connected independently, but it doesn't really look at work limitations individually. When the VA is looking at your disability, they're looking at it in terms of your overall life and not just focused on work, which is what TDIU does. So, functional limitations that the VA is doing is for all aspects of life. Your activities of daily living, going out and shopping or interacting into the community. Again, it's not just focused on work. Many times it's the work limitations a veteran has that is a combination of multiple service connected issues together. And basically what this means is, you know, some of your work limitations that are affected by your PTSD are at level 5, but if we look at your back or knee, now those work limitations, the exact same area, is a level 2. When the VA looks at that, they look at a 5 and rate it as a 5 when they're looking at your PTSD, and a 2 with your knee. When you get to TDIU and a vocational expert, we're looking at that 5 and 2, and we can actually add that 5 and 2 together and go, now the work limitation is a 7. This is also something your doctors and other healthcare providers aren't professionally trained to assess. And then the third step is to file for a secondary service connection. Secondary service connections refer to conditions that have been caused or made worse by a condition for which a veteran has been service connected. If 100% rating or TDIU are not realistic options for you, and claims or appeals have done nothing to sway the VA's original rating, consider if your PTSD has caused any other psychological or physical ailments. For example, PTSD can cause depression. And again, it's very rare to have PTSD and mental health conditions rated separately. It does happen every once in a while, but if you get, say, depression secondary service connected, it will increase your overall score. In addition, PTSD is highly correlated with chronic pain, and therefore you could get chronic pain secondary service connected. So, what can vocational expert do for you? Vocational experts and a vocational evaluation is needed to put your limitations in vocational terms to show unemployability at the sedentary and unskilled work levels. It's not just light duty work and sedentary work. You also are looking at skilled, semi skilled, and unskilled work. And the VA, even though these raters aren't fully aware of what the definition is or what competitive work is, they're measuring in their mind based on some concept they have to sedentary work or semi skilled work and unskilled work. And this is where a vocational expert is needed. Because you need a vocational expert that knows what these definitions are and what is required of competitive work in each of these areas in order to eliminate these jobs, i.e., make you unemployable. So, a vocational evaluation will include a review of your medical and psychological records as well as your VA decision letter. You will have a clinical assessment with a vocational expert. You'll discuss your work history and work skills. You will discuss how your symptoms, PTSD, as well as other service-connected symptoms, have affected your ability to obtain and maintain employment. Some vocational experts will do psychological and vocational testing. Sometimes not everything or all the evidence you need is in the file, and you'll have to get more information. Sometimes we can do psychological or vocational testing to help bolster your work limitations. This is to get an overview, but a detailed description of your work limitations. So, what do you need for a vocational expert assessment? Well, here are some minimums. You need your last VA award letter, the full letter that shows why you were diagnosed with what your symptoms they found, and what medical and psychological records they used to arrive at their determination. We would like your C file, and you can get this electronically. You want to make sure you know what are in your records and what records are positive for your unemployability and what records are negative or hold you back from unemployability. You want to make sure you have your DBQs and service-connected medical records that are not in your file. We like to look at a work history of at least 15 years. Sometimes we may ask for a longer work history. We come across a lot of veterans who haven't worked for 15 years, and in that case, we still want to know what your past work was. Again, the relevant rating decision that goes back to your last VA award letter. We also can look at your Social Security earnings records, and you can get this online at the Social Security Administration. If you do a vocational evaluation with us, we will ask for your medications and some other information. So if you're interested in a vocational evaluation with us, I have over 20 years experience as a vocational expert and have been a certified rehabilitation counselor for over 20 years. I have done many professional seminars for American Board of Vocational Experts, International Association of Rehabilitation Providers, National Association of Rehabilitation, as well as Georgia Licensed Professional Counselors Annual Conference. I've had a contract with Social Security Administration for 10 years as a vocational expert and have testified at over 10,000 Social Security disability hearings. I've done vocational evaluations for Georgia Department of Labor Rehabilitation Services. I have done psychological assessments and vocational services and job placement for Georgia Department of Behavioral Health and Developmental Disabilities. And I've worked at North Fulton Regional Hospital doing cognitive rehabilitation and vocational services, and we specialize in traumatic brain injury. So, a TDIU vocational expert evaluation. Step one, you need to schedule a personal consultation about your TDIU application and your VA service connected disabilities and how they affect you. Step two, if everything goes well, then we will do a personal evaluation of your medical and other records in depth. Step three, will determine if psychological or other testing is needed. For example, we might need to test for concentration, ADHD type symptoms, as well as mental health symptoms. And then, of course, step four is getting a vocational expert TDIU report.